10 alarming signs your blood sugar is too high. Blood sugar, or glucose, plays a vital role in our body's functioning. It's the primary source of energy that fuels our daily activities. However, when our blood sugar levels are consistently too high, it can be a sign of an underlying health issue, particularly diabetes. Monitoring your blood sugar is crucial, as prolonged high levels can lead to various health complications. In this video, we'll explore 10 alarming signs that your blood sugar might be soaring above healthy limits. Ignoring these red flags can have serious consequences, but recognizing them in time can be the first step toward better health and well-being. Whether you're diabetic or concerned about your blood sugar levels, understanding these signs is essential for managing your health effectively. Let's delve into these warning signs and empower you with the knowledge to take control of your blood sugar. 1. Being extra thirsty and having to urinate more than usual. This is a common but not so obvious sign of blood sugar that is too high, feeling really thirsty and needing to drink more than usual. Excessive urination, known as polyuria, occurs when glucose builds up in your blood and your kidneys begin working harder to get rid of the extra glucose. If your kidneys can't keep up and adjust blood sugar so that it returns to a normal level, the excess sugar is flushed out of your body through urine. You may become dehydrated and get dizzy. 2. You're hungrier than usual, but losing weight. Many people with uncontrolled high blood sugar find that they're hungrier than usual, which signals a symptom called polyphagia. And although you're eating more, you may be losing weight for no apparent reason if your blood sugar levels are too high. Since your body is not getting energy from the preferred source, glucose, it has to turn to muscle and fat. When your body starts breaking down muscle for energy, you experience unintentional and unhealthy weight loss. In addition to these changes in weight and appetite, you may notice weakness in your muscles and experience more frequent falls. 3. Tiredness and constant fatigue. Fatigue and extreme tiredness are symptoms of uncontrolled blood sugar. When our body does not process insulin properly or it doesn't have sufficient amounts of insulin, the sugar stays in our blood rather than getting into our cells to be used for energy. Also, frequent urination can lead to dehydration, which is identified as another contributing factor to fatigue. 4. You have noticeably blurry vision and frequent headaches. You may notice that your vision isn't as clear as it used to be, and that things may appear a bit blurry. High blood sugar levels can lead to swollen lenses in your eye from fluid leaking in. This changes the shape of the lens, which makes it unable to properly focus, causing blurred vision. You may also find yourself struggling at work, having difficulty driving, and suffering from frequent headaches. 5. You develop sores that tend to heal more slowly than usual. Cuts, scrapes, bruises, and other wounds heal more slowly in the presence of uncontrolled blood sugar. Diabetes causes nerve damage and affects circulation, especially in the lower legs and feet, which can delay healing because there isn't enough blood flow to the area. Even minor wounds are more prone to infections, which can become very serious and even result in amputations of the foot. 6. You notice tingling and numbness in your hands or feet. As mentioned, uncontrolled blood sugar can cause nerve damage, also known as diabetic neuropathy. What you may notice is a tingling sensation or even numbness in your hands and feet. Some people experience pain in their hands and feet as well, and the pain is often worse at night. Though neuropathy is most common in people who have had diabetes for a long time, it can occur in anyone with poorly controlled diabetes. 7. Skin changes. As is the case with many other signs of high blood sugar, skin changes on their own might not be cause for concern. After all, our skin naturally changes as the weather outside does, as our laundry detergents change, and as we upgrade our exercise routines. However, if extreme skin changes are observed in tandem with other signs of high blood glucose, it might be time to check in with your doctor. In people who have prediabetes, blisters, dryness, itchiness, and other abnormalities can become prominent. Additionally, skin tags, which are extra protruding pieces of skin, can begin to develop. Skin tags are relatively common in people with diabetes who are working on weight management. Dark, dense areas of comparatively soft skin can form on the hands, neck, face, and armpits, and can often be an outward sign of insulin resistance. Much like some of the other warning signs, it is important to take notice of what some might perceive as subtle signs in an attempt to stay healthy as you age via everyday health. 8. Frequent yeast infections. Hyperglycemia may lead you to get more frequent genital yeast infections. The culprit is often a type of yeast, a fungus, known as Candida albicans. According to the Centers for Disease Control and Prevention in females, the symptoms can include vaginal itching, redness or soreness, pain during sexual intercourse, pain or discomfort during urination, and thick, abnormal vaginal discharge. While yeast infections are common in people who don't have diabetes, having more glucose in your blood puts you at higher risk of getting them. The yeast feeds off the glucose, and if your blood sugar is high, there's more glucose in the urinary tract. 9. Dental complications. Since glucose is sugar on a fundamental level, it has the tendency to wreak havoc on our bodies, especially in excess. That being said, it also feeds harmful bacteria. When our bodies become overwhelmed, they have trouble regulating the bacteria, and an overgrowth, a yeast infection, can develop via self. We have a ton of bacteria in our mouths, and our sugar consumption can impact our oral health in epic ways. Glucose exists in our saliva and in our mouths, and when it commingles with the bacteria that also live in there, chaos ensues. By chaos, we mean that plaque can proliferate and lead to issues such as tooth decay, cavities, and bad breath. Many complications cannot be solved by upping your oral hygiene game once they start to spiral. To prevent these complications, the Mayo Clinic recommends committing to dental care. This includes regular brushing and flossing, of course. However, this type of care extends into being hyper-aware of the initial signs of gum disease. It's also important to inform your dentist about your high blood sugar if you have it. 10. Mood changes. Understanding the direct impact that high blood sugar has on mood is difficult to measure accurately, but many people with diabetes self-report that extreme fluctuations in blood sugar, high or low, can cause changes in mood and behavior. As we conclude our exploration of the 10 alarming signs of high blood sugar, it's essential to emphasize that awareness and action are your best allies in maintaining good health. High blood sugar, if left unchecked, can lead to serious health complications, but it doesn't have to be a looming threat. By recognizing these warning signs and taking them seriously, you're taking a proactive step towards better health. If you've noticed any of these symptoms or suspect your blood sugar might be high, it's crucial to consult a healthcare professional. They can help you with proper testing, diagnosis, and a personalized plan for managing your blood sugar. What do you think of our video? Let us know in the comment section below. Before you go, please hit the like button and subscribe to our channel. Thanks for watching.